Hello, my name is Julia, and here is my WAC presentation. My WAC poster title is Beyond the Bedside, Preventing ICU Delirium with Early Mobilization. My nursing-sensitive problem that I chose is delirium, which is a state of confusion that presents as deficits in memory, orientation, language, visuospatial ability, hypo or hyperactive activity, fear, depression, euphoria, or insomnia. Some background and cost of the problem and impact on the population. When patients are diagnosed with ICU delirium, they could expect an average of $17,838 increase in their hospital bill due to extra resource utilization. Delirium is also associated with increased mortality and morbidity, increased healthcare costs, increased length of stay at the hospital, higher risk of long-term cognitive impairments, and low quality of life post-discharge. If a client is diagnosed with dementia and then is diagnosed with ICU delirium, they can expect a mortality rate of 25 to 33%. Acute delirium causes memory problems, difficulty concentrating, and confusion that can lead to decreased ability to complete activities of daily living as well. Stakeholders relative to the problem will be the Agency of Healthcare Research and Quality, as they recognize the significance of delirium and the detrimental effects it has on patients. The organization has therefore dedicated funding and research to prevent the intensive care unit delirium. My intervention that I chose focuses on early mobilization from the ICU prevention ABCDEF bundle. The ABCDEF bundle is an acronym for a bundle of interventions that can be used to prevent ICU delirium. In this case, I decided to focus on early mobilization as it is the only intervention resulting in a decreased days of delirium. Furthermore, early mobilization can be described as exercises that support the patient through passive or active movement to maintain or support patient mobility. The purpose of this presentation is to present early mobilization as a useful intervention to prevent ICU delirium, while also discussing a plan to initiate the intervention, potential barriers, appropriate tools, and stakeholders that may influence the implementation of early mobilization in the adult intensive care unit. So the plan for implementation of the intervention is to first consider the key stakeholders: hospital administration and unit managers, nurses who will be doing the intervention, physicians, pharmacists, respiratory therapists, physical therapists, and occupational therapists. Resources to consider is training and education programs, mobility equipment, research assistance, financial support, and human services. Implementation is going to start with stage 1, the development and implementation of clear guidelines and protocols for early mobilization. This will have outlined criteria for patient eligibility, level of mobilization, and safety measures to minimize the risk of complications. Stage 2 will be education and planning, focused on resource management and training programs for the interdisciplinary team. In stage 3, nurses will start to implement this intervention by first creating an individualized plan and using the CAM ICU scale and RAS tools to evaluate their patients. Next, in stage 4, nurses will help the client engage in passive range of motion exercises, while then advancing to the active range of motion and finally ambulation. It's important to consider the interdisciplinary team, as physical therapists and occupational therapists can help the nurse execute this intervention as well. Finally, in stage 5, to evaluate the effectiveness of the intervention, we are going to compare baseline scores, neurological checkpoints, readmission, and the presence of ICU delirium or a reduction in delirium. Implication, gaps, and needs for future research. Barriers to the implication are going to be lack of resources, both financial, human, and equipment-wise, lack of coordination between the interdisciplinary teams, and finally, patient-related barriers like physiological instability or medical devices that can hinder the intervention. Policy implications would be to integrate a structured mobility program into standard ICU protocols. This can be something that nurses can implement into their care plans so that they can try and prevent that ICU delirium. Future research would include more research in understanding delirium etiology, possible preventative risk factors, and the pathophysiology. Finally, research on non-pharmacological prevention and treatment of delirium and association with long-term outcomes is also needed. For my research, I used the Creighton library database. When I was researching the problem of ICU delirium, I used the search words ICU delirium, mortality and morbidity rates, and consequences of ICU delirium. For my intervention, I also used the Creighton library database, and I used the words delirium, ABCDEF bundle, interventions, early mobilization, and I think that's it. Thank you for listening to my presentation. If you have any questions, I would love to answer them. And that concludes my presentation. Thank you.